Why did I choose to become a psychiatrist? For the money? No, I'm joking. It's not for the money. Hello everyone, this is Dr. Imran Versi. I'm a resident in psychiatry and it's a pleasure to be here, and I'm here to answer a few questions. So let's just dive into it. Hello everyone, this is Dr. Imran Versi and I am honored to be here today, as you can see from the branding with quick ones. And I'm a resident in psychiatry and it's a pleasure to be here, and I'm here to answer a few questions. So let's just dive into it. What does it take to become a psychiatrist? Many people all over the world, not just Kenya, many people don't know the difference between a psychologist and a psychiatrist. So a psychologist is a mental health professional who is specialized in behavioral counseling, therapy, looks into somebody's behaviors, emotions, and is not a medical doctor but uses these sort of skills to help a patient have the coping skills to become better. A psychiatrist, on the other hand, is a medical doctor who has specialized into mental health and can now prescribe medications and use pharmacology as a method of treatment. How many years does it take to become a psychiatrist? Considering you don't fail your exams, generally it takes 3 to 4 years. But you could take longer if you love what you're doing maybe and you want to stay for longer. But generally 3 to 4 years, usually all over the world, that's the number of years it takes to do a master's in psychiatry. Is psychiatry just like studying medicine, or is it something more? It definitely is medicine, because in order to become a psychiatrist, you have to become a medical doctor first and thereafter specialize. So just look at it as, you have skin specialists, bone specialists who specialize after becoming doctors. So psychiatry is similar. You become a doctor and then you specialize in psychiatry. And yes, it's not only medicine, it's more about neuroscience, it's more about looking into family dynamics for the patient, and most importantly, reading the patient and reading those cues that are not very prevalent to you. So for example, you read body language, you read the silence, you read those things that are not very evident to you. So it's a lot more. Why did I choose to become a psychiatrist? For the money? No, I'm joking. It's not for the money. The reason I chose to become a psychiatrist is, I remember when I was doing my internship in Tanzania, there was somebody who came into the hospital with delusions, and that really fascinated me. And auditory hallucinations. Basically, he was hearing voices talking to him. He could see people who are dead from his family members. And a number of incidents combined made me realize that this is the field for me. My first day I think was the worst day when I got into the hospital. And textbooks don't cry, but patients do. And the first day I see a 20-year-old young woman who comes into the clinic with a depressive disorder, crying, and I don't know what to do as well. With psychiatry, it's not only the knowledge, it's about experience on how you handle things, how you handle matters, how you handle situations. So the first day was really draining. I remember I probably slept for 14 hours and it was really draining. But yeah, the first day was very bad. Got a number of cases which I did not know how to handle, and therefore I was just calling my supervisors and my seniors and my consultants to ask them on how do I handle certain situations. How much does a psychiatrist typically earn? Very little compared to the amount of work that we do, but it depends where you are as well. Generally the salary of a psychiatrist depends whether you are working in a government center, an NGO, you're working with big companies like quick ones, then you earn more. But typically it's between 300,000 and more, depending on where you are. Are there specialties within psychiatry? Yes, there are. So for example, you have super specialization or specializations in psychiatry to do with children, pediatrics, to do with the elderly, geriatric psychiatry, to do with, for example, forensic psychiatry, criminal psychiatry, those people who are known serial killers, murderers, etc. So forensic psychiatry, it's a field that I am very fascinated by. Probably I have psychotic traits, I'm not sure, but it's something that really fascinates me. Is psychiatry seen as a long-term career? Yeah, I mean, this overweight you see is because of psychiatry as a career. So yes, it's a very good career, although I think mental health specialists, be it psychologists or psychiatrists, need their own coping mechanisms and coping skills to deal with the stress that they face at their workplace. The hardest and the most rewarding aspects of psychiatry. I think the most rewarding aspect of this field of psychiatry is when you see somebody suffering for very long and when you are able to treat them and basically the smile on their face, their ability to go back to work, their ability to reunite with their family, their ability to basically have a social life. I think that's the most rewarding part of this job. And the hardest part is, actually the hardest, most difficult part is seeing illnesses and conditions that are preventable, but because of stigma, people don't come forward. I think that's the hardest and most challenging part, because you know this can be resolved and you know for sure that this can be sorted, but yet people don't come forward. I think that's very difficult to see. Could you give examples of such that are preventable? Yeah. So for example, anxiety disorders, be it generalized anxiety, phobias, OCDs, even depressive and other mood disorders as well, with treatment they get much better. However, because of the stigma that we have all over, I mean it's global, internationally, people don't want to be seen with a psychiatrist. I know there are times when I'm talking to somebody and person C will look, that guy has a problem, huyu jamaa ana shida. So why is he with Dr. Imran, for example? Why is he talking to him? And we could be discussing credit cards and phone salios. My salio is over and I'm just asking him to help me out with Safaricom. But people look at it very differently. So the stigma is still there. How do I manage my own mental health whilst helping others? To be very honest with you, sleep. I love my sleep. FIFA. Reading books, studying different various types of knowledge. I love learning languages, different languages, and so I think this is one of my ways of coping with work stress. How do I unwind? Okay, how do I unwind? What does wind mean? And then what does unwind mean? I think unwinding, generally, spending time with family, going out, playing football. It doesn't look like it, but I do love football. Might not be very good at it, but I love being on the field. Do psychiatrists experience burnouts? Yes, a lot. In fact, there's a couple of research done that mental health professionals need some sort of venting mechanisms or some sort of counseling as well. Sometimes we do require them. Psychiatrists and psychologists do burn out and they do require help. It's just that we are more aware now of the symptoms. We are more aware of signs and symptoms of a burnout, for example, but we do need coping skills as well. Do psychiatrists always have perfect mental health? No, I think this is a very big myth. We all have mental health issues. Psychiatrists, just like anybody else, can go through any mental trauma, can go through abuse, can go through childhood trauma, can go through post-traumatic stress disorder, and it's very common. So definitely, we are as vulnerable and susceptible to mental health conditions just like anybody else. Do you ever think about patients after work? A few of them do stay with you even when you go back home, especially the more serious ones. For example, we do have cases of gender-based violence, especially against girls and women in our country and globally everywhere. So such cases, rape cases, for example, they do stay with you. They do stay with you even when you go back home. How did your family react to your career choice? They asked me, what psychiatry is, and when I explained to them, they said, yeah, more than becoming one, you might need one. But after that, they were concerned and they were very supportive as well. It was a mixture of both. Do people misunderstand what you do? Almost always. People definitely misunderstand the field of mental health, the field of psychiatry. They feel that whoever comes to a psychiatrist is, in Kiswahili they say ni wazimu, or he's mad, or he has lost it, whilst not knowing that psychiatry is an umbrella that encompasses so many conditions. We have patients come in who are professors in their field of mathematics, of physics, of any other field of education, but they go through certain stresses and certain trauma in life. So definitely people do misunderstand that psychiatrists and psychologists don't treat mad people, they treat mental health, and that's the difference. How do you handle stigma around mental health? So one of the ways to counter stigma around mental health is obviously things like what we're doing today with Quick Ones. We are educating people and trying to give them the knowledge to be able to differentiate and to discern from what is the truth and what is a myth. And the problem is that many times today people don't realize the importance of mental health. So I'll give an example. You could have somebody who has constipation or diarrhea or has stomach ulcers or a headache or pneumonia, and he'll be very open about talking about their condition. Jana nilikuwa na diarrhea, jana nilikuwa na constipation, juzi nilikuwa na pneumonia. But suddenly when it comes to mental health, it's as if the brain is no longer the part of the body. It's as if the brain is no longer an organ. The only organs we have are the heart and the liver and the lungs, but no, rather on the contrary, the brain is probably, if not the most, then one of the most important organs in our body. But yet we treat it like it's alien and we don't want to talk about it. In fact, I get calls sometimes, Daktari, we want to come meet you, but virtual. We don't want to, and they live like half a kilometer away. In fact, if I throw a stone from my window, it reaches their house. But they just don't want to walk for 11 steps to come into the clinic, solely because they don't want anybody to see them entering into a psychiatrist office or clinic or a mental health facility, which is something we really need to look into. And one of the ways is by doing this. Yeah, I know I'm branding Quick Ones too much, but yeah, it's important. Would I encourage someone close to me to pursue this career? Of course. Now, it depends on your interest. When I completed my medical studies, became a medical doctor, I had a number of options in front of me. Pediatrics, for example. I really wanted to become a child specialist. This is something personal. But I think in third year, when I entered into the children's ward, the neonates, and the number of crying with decibels reaching 4,000, I said, no, I cannot do this. And slowly, as we started rotating in different fields, cardiology, emergency, dermatology, etc., finally we reached psychiatry, and I said, yeah, this is for me. I think it's more about passion and interest. If somebody has the passion and the interest, most definitely this is a very emotionally fulfilling career. Can you know the status of someone's mental health just by looking at them? So I have with me the staff and the company of Quick Ones in front of me. I've already read a couple of you. I can see certain substance addictions and stuff, but no, not really. We cannot just read somebody by looking at them. We are not psychics, and mainly because a lot of people going through mental health struggle in silence, and that's the problem. You would find a number of people who have attempted suicide, and you'd be surprised. This guy, I was laughing with him yesterday. Last week we went to a party. Day before we were at a picnic. He was laughing, he was normal, and suddenly today we hear the news that he has attempted suicide. So a lot of people struggle in silence, and which is why it's difficult to read them. What's the biggest myth about mental health? The biggest myth about mental health is that it goes away with a snap of a finger. You know, for example, because I come from an Indian background, I know some certain Indian cultures and families, they'll tell you there's nothing like anxiety, there's nothing like depression. Just sleep early, wake up early, drink enough water, and you are good. You know, the trauma doesn't matter. There's nothing like trauma, which is the biggest misconception, I think, in the field, one of at least, in the field of mental health, that things can get better without seeking professional help. Are patients usually dangerous or unpredictable? For the vast majority, not really, because a lot of patients who walk into a psychiatry facility to see a psychiatrist or a psychologist come on their own. They're dealing with certain life stresses, and they walk out on their own. Of course, we have a couple that could be unpredictable, could get violent or aggressive, depending on their level of insight, their psychotic features, for example. And we have certain conditions that in which patients can get violent, but for the vast majority, not really. If you do go into any mental health facility, you'll see a number of people who are in the waiting area are seated normally quietly, although we have exceptions. How do you know if someone needs a psychologist versus a psychiatrist? So, as I mentioned in the beginning, a psychologist uses behavioral therapy, counseling, and basically talk therapy to try and help somebody going through mental health challenges, which is a very important field as well. And on the other hand, a psychiatrist is a medical doctor who can prescribe medications. So basically, typically a psychiatrist would prescribe antipsychotics, antidepressants, let's say mood stabilizers, etc., medications for ADHD, and the likes of it. So many times you find that psychologists and psychiatrists work hand in hand and work together to be able to help people. Do therapy sessions actually change behavior long term? Yes, they do, as long as people are consistent. There's two challenges when it comes to behavioral therapy or psychotherapy, what we call it. Number one, a number of people change their psychotherapists. So you could go to one the first week, another one the second, and a month later a third. So the problem with this is that when you meet with a psychotherapist or a psychologist, you are forming a bond, a rapport between the patient and the psychologist, and that is very important as well. And the second aspect is consistency. And there's inconsistency in both sides. There's inconsistency in the field of psychiatry when patients are not compliant with taking medications, for example. They'll take them for a week, for 2 weeks, and then they'll feel better and stop them, which is a problem because mental health conditions take time to treat. You can think of it similarly to diabetes or hypertension. Yeah, you can't have diabetes and say, I'll take my medicines every Thursdays and Saturdays. You have to be compliant and take them daily. You can't say, today my sugar levels or my pressures are normal and therefore I don't need them. No, the reason that your sugars and pressures are normal is because you are taking your diabetes medications. You are taking your antihypertensives for your blood pressure. And that is why your blood pressures and sugar levels are in check. Similarly, with mental health conditions, they get better 2 weeks, 3 weeks, and then they are lost, and then they come back and they are very severely affected, and they have very severe features and symptoms, and they come back and they are admitted in the ward. However, had they been taking their medications, this would not have been the case. And then on the other hand, with psychologists as well, people are not consistent with their dates for coming back for psychotherapy, and I think both of these hinders appropriate treatment. Is psychiatry just talk, therapy and pills, or is there more to it? Definitely there is more to it, because when you are treating an individual, you are not just treating that person. Because of mental health challenges, that person has relationship issues, that person has physical issues, sleep issues, insomnia, eating disorders, etc. That person has challenges at their workplace. Basically, their social, personal life is being affected. And so the field of psychiatry or psychology looks at all these dynamics to be able to help an individual holistically. Do psychiatrists find themselves bonding with a patient more outside of the clinic or therapy? Yes and no. You could have patients that are quite stable and you see them maybe once in 3 months or once in 6 months. When they come back to refill their medications, probably you ask them if they have any side effects, any new symptoms. A number of people need that continuous monitoring. So yeah, certain psychiatrists and psychologists do have follow-up sessions with their clients or with their patients. And once they are stable, I think the interaction decreases over time. Do psychiatrists have patients that scare them? Yes, there are a few. I would not say they are scary, they are normal. However, because of a mental health issue, I remember there was a young, I think a 35, 40-year-old girl who had come into the clinic once, and she had auditory hallucinations, and I was trying to ask her, how often do you hear these voices? And she's like, I hear them every day, every time. And I ask her, okay, what do they tell you? Wanakuambiaje? And she's like, they tell me different things. And I asked her, sasa hivi hizi sauti zinakuambiaje? What do they tell you now? What are they telling you now? And she looks at me dead shot into my eye and tells me, hizi sauti zinaniambia, huyu daktari mbele yako muue. Kill this doctor who is seated in front of you. Now, you might be a man, but in certain situations, your manliness does go away and you start getting scared in certain situations. And this was one of them. But within a few seconds she calmed me down and said, I don't have to really act on these voices, so don't worry, you are safe. So there are certain cases whereby you do feel a bit scared, you might have a bit of fear, but it's the realization that the person in front of you is unwell, which is why they are here, and you are the specialist to care for them and treat them. And eventually this woman became a lot better, got treated, and she's gone back to work and living a very normal life. Do people really need medications to manage mental health? No, which is why the role of psychologists is very undermined and underplayed, or the importance is not given to them. They are undervalued as well. Psychologists who do talk therapy, counseling, as long as they are professional psychologists, they have a very important role to play, because a number of mental health conditions, depending on the severity, does not really require medications in the early stages. Of course, with things like psychosis, you might need to intervene with medications first. However, there are certain conditions, for example, if the anxiety is mild, or you're having certain conditions that does not really necessitate medications, that's where psychologists play a very important role. Without breaking confidentiality, can you tell us something unusual or interesting experiences? So, number of interesting and fascinating experiences. I think now, as you gain experience into the field of psychiatry, you see a couple of patients every day, you sort of get, maybe immune is not the right word, but you sort of get used to seeing certain cases. But definitely in the beginning, it was overwhelming for me as well when I see patients come in with say grandiosity, delusions of grandiosity, whereby they believe they are talking to a superior being, or they'll come and tell you that this whole hospital or this area or this land belongs to me, or I am Elon Musk's son and I'm the richest man alive. So you have certain cases whereby you do feel sort of fascinated by them, but usually that's in the beginning and then you get used to it. Moments that made me think human behavior. I think a specific moment that made me really reevaluate or rethink human behavior is when I had a patient who, as typical, generally this happens, that the family were not understanding that he had a mental health condition, and therefore the family members were very much, he was going through trauma, stigmatization, and a lot of family members were, putting him down, speaking against him. But later, when he got better and when we had our family therapy sessions, and when the family realized that what he's going through is something genuine, and eventually when they accepted it, and this patient very willingly with a smiling face forgave his family members, I think that was a moment that really made me rethink human behavior. The weirdest therapy method in the field. So many people don't know about this, but you must have heard about this. It's called electroconvulsive therapy, or ECT, or shock therapy, whereby certain rods are placed over your head, and with a machine, certain voltage of shock is given. However, I had somebody who asked me, I feel if I come into the psychiatric facility, it's like, when you enter a hospital, they check your blood pressure first, your sugars first. And this person thought that when I enter a mental health facility, instead of checking my blood pressure and sugar, they'll give me shock therapy first before I see the doctor, which is a misconception. Shock therapy is usually one of the last resorts, or a plan C or D that psychiatrists usually have. But it's not the first line of treatment, definitely. Moments that have made me laugh. Yes, I had a patient come to me and tell me that I am Prophet Moses, and I have just come from splitting the sea, and I'm here to overthrow Pharaoh, and it looks like you look like Pharaoh, and I'm here to overthrow you and stuff. And I tried to calm him down, and the guy comes from just nearby, I think Gara area. So this was something that was funny for me. How does psychiatry change how you view people and your relationship with others? It changes the way I view people, because I think now I am more understanding of how people react, why they react in a certain way, what they do, how they and why they do it. Usually people who have mental health challenges, you'd find that, for example, in a workplace you could have, or in a school setting, you could have a child who has dropping academic grades, no focus, low concentration. Ideally and generally, you would start scolding the child or punishing the child or that individual. But as psychiatrists, I think we are more susceptible and more aware that the child could be facing bullying in school, for example. The child could have some sort of a seizure disorder. The child could be going through trauma or abuse at home. And therefore, I think it makes us more aware of why people do things rather than just look at the action itself. What lessons do I take from patients that impact my own life? I think perseverance and patience. There are certain patients who come and I'm really shocked as to how they could deal with their mental health struggles for this long and not break down. So I think there are a number of people who have a lot of capacity of patience and perseverance, and the people are going through a lot of issues and a lot of struggles and challenges, and it's just fascinating how they're able to deal with it. If the public really understood your work, what would surprise them the most? I think what would surprise them the most is what we mentioned earlier, that mental health, mental awareness, mental health is a path. I mean, we all go through certain types of stresses and trauma in our lives. I don't think anybody who's watching this video can say, I've had a very high five-star life my entire life. I have never gone through ups and downs. I have never gone through struggles. And I think if some of the people in the community or generally the public, they feel that mental health equates to madness, for example, which is incorrect. Everybody goes through mental health challenges in their day-to-day life. It just depends how strong their coping skills are, how strong their coping mechanisms are, and how aware they are of their condition to be able to seek help. Top 3 tips for your mental health. I think number 1, environment. Associate yourselves with the right company. Because a lot of, especially in Kenya, there's a rise in substance use, rise in substances like marijuana, cocaine, etc. And one of the reasons, when you trace back the roots of it, is bad companionship. So I think friendship, even parents need to be aware who their children associate with. That's very important. I think too much confinement is bad, and excessive freedom is also bad. I think there needs to be a balance between the two. Number 2, take care of your physical health. A lot of people face mental health challenges because maybe they don't sleep well or they don't eat well. So I think taking care of ourselves is of utmost importance to be able to cater for our mental wellness. And number 3, go out and associate yourself with your family members and have one person that you can talk to. Have one individual, at least one in your life, who can act as a mentor towards you, who you can confide in. Because one of the biggest challenges of mental health is not being able to confide in the right person. So if everybody watching this were to have or come up with one mentor in their life who they can talk to, get advice from, and confide in, and I think that makes a big difference to people. Any advice for people who are hesitant to seek mental health treatment or therapy? My advice generally would be, there's a lot of stigma going on around the world. There's a lot of misinformation. However, I think the first step towards recovery is recognition, awareness that this person, myself or somebody around me, my family member, a loved one, is going through certain struggles. I think that awareness is very important, and after this awareness is when you can seek help, and treatment is very readily available all over the country. But I think awareness is important, and I think the general public needs to be educated on at least the basic red flag symptoms or signs that they can see in their loved one, and which can make them realize that there's something going on and I need him or her to seek help. Could you tell us about the facility that you are at? Okay, so Al Shifa Care Home is a facility located in Levington, Owashika Road, which deals with both out and in patients with regards to psychiatric issues, especially geriatric care, elderly, dementia, and various other conditions. And yeah, I think through this platform, people are very welcome and to come to us and seek help.